Now we are going to talk about high density lipoprotein from Wikipedia, the free encyclopedia. In this lesson, we will just talk about increasing HDL levels or high density lipoprotein levels, diet and exercise, recreational drugs and pharmaceutical giants, and niacin. Increasing high density lipoprotein levels or HDL levels. While higher HDL levels are correlated with lower risks of cardiovascular diseases, no medication used to increase HDL has been proven to improve health. Numerous lifestyle changes and drugs are under study to increase HDL levels as of 2017. HDL lipoprotein particles that bear apolipoprotein C3 are associated with increased rather than decreased risk for coronary heart disease. Diet and exercise. Certain changes in diet and exercise may have a positive impact on raising HDL levels. Decreased intake of simple carbohydrates, aerobic exercise, weight loss, avocado consumption, magnesium supplements raise HDL-C, addition of soluble fiber to diet, consumption of omega-3 fatty acids such as fish oil or flax oil, increased intake of unsaturated fats, consumption of medium-chain triglycerides, MCTs, removal of trans fatty acids from the diet. Most saturated fats increase HDL cholesterol to varying degrees, but also raise total and LDL cholesterol. Recreational drugs. HDL levels can be increased by smoking cessation or mild to moderate alcohol intake. Cannabis in unadjusted analysis. Fast and current cannabis use was not associated with higher HDL-C levels. A study performed in 4,635 patients demonstrated no effect on the HDL-C levels, P is equal to 0.78. The mean standard error HDL-C values in control subjects never used. Past users and current users are 53.4, 53.9.6 and 53.9.7 milligram per DL respectively. Pharmaceutical drugs and niacin. Pharmacological therapy to increase the level of HDL cholesterol includes use of fibrates and niacin. Fibrates have not been proven to have an effect on overall deaths from all causes despite their effects on lipids. Niacin or vitamin B3 increases HDL by selectively inhibiting hepatic diacylglycerol acetyltransferase 2, reducing triglyceride synthesis and VLDL secretion through a receptor SM74, otherwise known as niacin receptor 2 and SM74A, GPR109A, niacin receptor 1. Pharmacologic 1 to 3 gram per day niacin doses increase HDL levels by 10 to 30%, making it the most powerful agent to increase HDL cholesterol. A randomized clinical trial demonstrated that treatment with niacin can significantly reduce atherosclerosis, progression, and cardiovascular events. Niacin products sold as no flush, i.e. not having side effects such as niacin flush, do not, however, contain free nicotinic acid and are therefore ineffective at raising HDL, while products sold as sustained release may contain free nicotinic acid, but some brands are hepatotoxic. Therefore, the recommended form of niacin for raising HDL is the cheapest immediate release preparation. Both fibrates and niacin increase artery toxic hematocysteine, an effect that can be counteracted by also consuming a multivitamin with relatively high amounts of the vitamin B or of the B vitamins, but multiple European trials of the most popular B vitamin cocktails trial showing 30% average reduction in homocysteine, while not showing problems, have also not shown any benefit in reducing cardiovascular event rates. A 2011 niacin study was halted early because patients adding niacin to their statin treatment showed no increase in heart health, but did experience an increase in the risk of stroke. In contrast, while the use of statins is effective against high levels of HDL cholesterol, most have little or no effect in raising HDL cholesterol. Rosuvastatin and pitavastatin, however, have been demonstrated to significantly raise HDL levels. Lovaza has been shown to increase HDL-C. However, the best evidence to date suggests it has no benefit for primary or secondary prevention of cardiovascular disease. Though it has not yet been FDA approved, the PPAR modulator, sometimes referred to as a SARM GW501516, currently a research chemical not for human consumption, has shown a positive effect on HDL-C, and anti-atherogenic where LDL is an issue. So I hope you have already enjoyed listening to this video on how to increase HDL levels. So once again, I'd like to tell you, I would always cordially appreciate any endeavor, any attempt, any trial from you to subscribe to this channel, to like the videos, and to comment and to share. So thank you very much. Thank you for your patient hearing. And don't forget to subscribe to this channel for getting newer videos on English reading. Thank you very much.